Hello, my name's Jane Cardiff and I'm the social worker in the Centre for Obesity Management in St Columcille's Hospital. And today I'm going to be talking to you around how we treat obesity as a disease. Here in the Centre for Obesity Management, we think about weight differently to what you may have experienced before. We know that a lot of our body weight and where we carry weight, in fact up to 70%, is down to genetics. That's much more than the general public or lots of other healthcare professionals understand. And we know from scientific studies that weight is like height or eye colour or needing to wear glasses. It's something that's with us from birth. We're all wired in a certain way and we are all individuals and different. Some people are very healthy living at a higher body weight, while other people, and again this can be down to genetics, develop physical or mental health complications from having higher levels of body fat. That's how we define obesity as a disease. It's having higher levels of body fat with health complications. And that's the reason people are referred to this medical clinic. Those health complications can include problems with our gut, like acid reflux, or problems with our liver, our joints, the lungs, and the heart. Type 2 diabetes, sleep apnea, infertility, incontinence, depression, low mood, or anxiety. And again, these are often the reason people are referred to this clinic. So, we all live in a world that isn't very weight friendly. We're surrounded by cheap and easily available high calorie foods and a lot of us live busy lives where it isn't easy to be active. So why do some people gain more weight and develop health complications than others in this environment? Well again, that comes down a lot to genetics. On this graph, if you're on the red line and don't have a lot of obesity genes, then regardless of food availability, you probably won't gain a lot of weight across your lifetime. If you're on the green line, which is where most people in the general public are, then as food availability increases, people are more likely to gain weight. And then if you're on the purple line, which many people who are referred to this clinic are, then you can gain a lot of weight in this environment. I'm not explaining this to make it seem hopeless. There are definitely things that can help with weight management regardless of your genetics, but just to explain why you may be different to other people that you know. On top of genetics, we know that some individuals are more likely than others to gain weight and develop health problems if they have certain health conditions such as depression, have an eating disorder, have a history of trauma in their life, are less mobile, have a diet that is low in protein or fiber, live in poverty or have less social support, have short or poor sleep, have high levels of stress, or are on medication that causes weight gain. It's these factors rather than genetics that are sometimes more straightforward to address during obesity treatment. When we are treating obesity, we have to understand the science of how body weight works. Our bodies are wired to stay at a certain weight. That's called our set point. We're often not aware of it, but on the inside, our brain and our hormones work together to keep our body at its set point. And that set point is different for everybody. If we lose weight, especially if it's more than 5 or 10%, our body will slow down our metabolism and make more hunger hormones to try to bring our weight back up, a bit like a yo-yo. So in this clinic, we'll focus on treating obesity as a disease. Our focus is on improving health, quality of life, and managing weight in a realistic way in the longer term. We often use the example of an optician. An optician can't change the genes that we are born with if we need glasses, but they can offer us treatment options. For example, regular eye tests and drops when needed, the right shape, colour and prescription glasses for us, and in some cases contact lenses or surgery. So that's what we're here to do, to figure out the best treatment options for you. We won't be overly focused on the scales. We'll be working with you to find your best weight, which is the weight that your body is when you're living your healthiest life that you can enjoy. So we'll be looking at eating, activity, thoughts, sleep, and self-care. The average weight change to expect from changes to any of these things is about 5 to 10%. And in some cases, if we add medications or surgery, this can increase to 15 or 30%. But more importantly, health improves with all of these treatments.